Gender inequality cause healthcare failure. Hello everyone, welcome to the Lancet Summer YouTube channel. I'm Dr. Armin Khavandegar, a medical doctor and medical researcher, and here we are with Dr. Payman Salamati, a professor at Tehran University of Medical Sciences, specialized in the field of social and preventive medicine, and Dr. Ali Haidari, a medical doctor and medical researcher. In this channel, we are going to summarize medical hot topics recently published in the Lancet Journal. Dr. Salamati, what paper are we going to discuss today?
Hi everybody, thank you so much Armin and Ali. The title of our paper is Delivering Health for All, the Critical Role of Gender Responsive Health Systems. It was published in the Lancet Global Health Journal and the type of the paper is a comment, and the others are some researchers from different international organizations such as WHO and UN, and it was released in March issue of the journal.
Recently, the World Organization asked countries to pay attention to the issue of gender. Would you please care to explain about that?
You know that the 8th of March is the Women's Day anniversary, and the two international organizations, I mean the Coalition of Partnerships for UHC and Global Health and the Alliance for Gender Equality and UHC, asked all countries to take a gender responsive approach to achieve UHC. UHC can only be achieved when the officials address inequalities, particularly gender inequality.
Could you please explain a little bit more about gender equality and universal health coverage?
Gender equality means equal rights and equitable health services access for all with any kind of diversities. Also, WHO defines UHC as all people have access to the full range of quality health services they need when and where they need them without financial hardship. Armin and Ali, could you please read 8 global targets of the Sustainable Development Goals?
Yes, the first one is end all form of discrimination against all women and girls everywhere.
Another one is eliminate all forms of violence against all women and girls in the public and private spheres, including trafficking and sexual and other types of exploitation.
The third one is eliminate all harmful practices such as child, early, and forced marriage and female genital mutilation.
The fourth one is recognize and value unpaid care and domestic work through the provision of public services, infrastructure, and social protection policies, and the promotion of shared responsibility within the household and the family as nationally appropriate.
And also ensure women's full and effective participation and equal opportunities for leadership at all levels of decision making, political, economic, and public life.
Another one is ensure universal access to sexual and reproductive health and reproductive rights as agreed in accordance with the program of action of the International Conference on Population and Development at the Beijing Platform for the Action and the Outcome documents of their review conferences.
Furthermore, undertake reforms to give women equal rights to economic resources as well as access to ownership and control over land and other forms of property, financial services, inheritance, and natural resources in accordance with the national laws.
And enhance the use of enabling technology, in particular information and communications technology, to promote the empowerment of women.
And at last, adapt and strengthen sound policies and enforceable legislation for the promotion of gender equality and the empowerment of all women and girls at all levels.
In recent years, the United Nations has issued two declarations on UHC. Would you please explain about that, Dr. Salamati?
For sure, the UN released two political declarations on UHC in 2019 and 2023. The declarations state that member states recognize that gender equality is necessary for UHC, and UHC can empower girls and women, support gender equality, develop the economies, and help peaceful and inclusive societies.
Would you mind elaborating on gender as a social factor which is affecting health?
The SDH, or social determinants of health, are non medical factors which influence health outcomes. They are the condition in which people are born, grow, live, work, and age. And gender is a critical SDH. Gender inequality decrease people's access to health services and endanger women's and girls' health and well-being.
Do you consider the current health status of women and girls favorable?
Not at all. Now, girls and women are dying due to preventable causes during pregnancy, childbirth, and unsafe abortions, and due to lack of autonomy about their health. Recently, UNAIDS announced that new HIV infections in Africa were more common among girls and women compared to boys and men, and the female to male ratio was 1.5, and there were 3 times more new HIV infections among girls and women aged 15 to 24 than males at the same age group.
Regarding providing gender equality in the field of health, what are the responsibility of governments?
Governments should be ensured that girls and women are present in health policy and decision making. They ought to create an ecosystem in which girls and women's voices and perspectives can be addressed, and they must invest in women's and girls' health needs.
At the end, what do the authors of the study conclude?
They conclude we need to ensure there is no barrier and no stigma for health service access because of gender identity and sexual orientation. Also, they emphasize that if we don't have a gender responsive approach, our healthcare system will fail.
Thank you for your time and explanations. Once more, the goal of this YouTube channel is to provide a summary of medical health topics recently published in the Lancet Journal. Don't forget to like this video, leave a comment below this video, and subscribe our channel.